The Dark Knight by Guy Carpenter. Character analysis for the Joker. The Joker is the antagonist of the film The Dark Knight. The Joker fights Batman throughout the film and occasionally will fight other gangs, his own henchmen, or the police. The Joker tries to destroy the city through organized crime and putting targets or killing individuals of danger to his cause or those who run the city. This film is based off of the Batman movie series called The Dark Knight Trilogy. The Dark Knight is based 1 year after the previous film in which crime is once again running the streets. However, the Batman is stopping this crime. In doing so, the Joker wants an uprising to take over the city, and he tries his best to continuously fight Batman and any law officials possible. He creates his own army of henchmen, including some of which who were previous criminals, or some who actually came from the psych ward for being schizophrenic. Mental diagnosis of the Joker, ASPD. The Joker is believed to have many strange qualities, some of which fit multiple different disorders. However, there is one specific diagnosis that is believed to be the most truthful. This disorder is the antisocial personality disorder, or ASPD. This disorder is best described by the Mayo Clinic. It states, a mental disorder in which a person consistently shows no regard for right and wrong and ignores the rights and feelings of others. Many symptoms include disregard for right or wrong, deceitful, cynical and disrespectful, very manipulative, senses of superiority, problems with law including criminal behavior, impulsiveness, hostility, a lack of empathy, a lack of planning ahead, abusive relationships, and lots of risk-taking, which can often have negative consequences. This personality disorder can be shown through all cultures and races. This oftentimes is shown in movies as white characters. However, in the real world, all can suffer from this. Evidence behind antisocial disorder. Many of the symptoms from ASPD are shown inside of the Joker. However, the two main symptoms which I'd like to address is the disregard for right or wrong and abusive relationships. While looking at the Joker's disregard for right or wrong, there honestly inside of the movie is very little right to no right made by him. He murders hundreds of individuals inside of the movie, including his own crew, many law officials, and even the commissioner. He tries to overtake the city and put it in a state of anarchy. He blows up hospitals, warehouses, and even the police station. Inside of the movie, the Joker has many different abusive relationships. Not only what he abused, but he abuses the people in his life. He was abused by his father with a blade in which he carved his face in, and watched his mother die from the same blade. The Joker's wife had scars carved into her face from a gang, so the Joker did the same to his own face. In doing so, she left, and then he decided to pick up a larger life of crime, murdering other gangs, including members of his own. So, how could this be treated? There are many ways that this disorder can be treated. In order for it to be treated, the character must be taught right and wrong, but at the same time, there's a secret weapon that can be used. This would be therapy. Therapy is able to calm the minds of individuals and at the same time can change the way some individuals think. Although some, mainly older cases, may not be treated as well, this is a treatment which could stop many upcoming generations from having ASPD. It is also safe for the patient. The main concern for treating ASPD is catching it early. Symptoms of ASPD are usually worse between 24 and 44 years old, so treating it early causes it to be less severe. Home life is also a barrier which can serve as a good or bad way of treating ASPD. If a patient lives in a bad home life, it is best to try and help get them out of that home life. So how is ASPD shown in films? In the movie, ASPD is shown through the villain. He is very manipulative, has no knowledge of right and wrong, has a sense of superiority, and a problem with law officials, lies often, very impulsive and hostile, and has many abusive relationships. This film has a very accurate depiction of this disorder. ASPD is shown in films often through the villains or as a deranged individual. Many films often mistake ASPD for schizophrenia or vice versa, as they are so similar. Films often show ASPD as more negative than it can be at times. Yes, there are criminals who may suffer from this and have many of the Joker's own symptoms. However, many individuals have more mild cases of ASPD.